My name is Lauren. I work at Pet Doctors, Normandy, Tongham, Godalming. So that's a couple of CVS branches. I completed the CertAVN medical pathway at the RVC. I wanted to undertake the course because obviously the RVC is quite a prestigious university. I had been 10 years qualified and not really progressed in an educational way. I've got friends who had done a similar course a couple of years ago and were really complimentary about it. And I wanted to evolve my skills and contribute more to potentially the diagnostic process, patient care, holistic patient care specifically. So it appealed to me on that basis. The aspect of the course that I enjoyed the most and have put into practice the most was the hematopoietic disease portion. I have, since graduating, become rather proficient in peripheral slide examination, and I really enjoy the intricacies of blood work and what it can show you or contribute to a big picture. The most interesting aspect of the course for me was most definitely the pathway portion of the course, which was the final module. I learned so much more than I thought I could with regard to disease process and how patients can differ so much. It's a really fascinating subject. And I love that there's so much more to it. You physically couldn't teach all of this in one course. I love how it gave me the opportunity to expand my knowledge on my own. And I think the course throughout actually really provided that opportunity. It taught me how to do my own research and how to expand what I already know or what I think I know and what to look at in order to continue learning. So I think standout knowledge and skill that I've probably developed since the course the most would be leadership skills. And that's not just general. I would say that that's more patient care, in that I will go really into detail when it comes to a specific case. And as a result, my team are starting to do the same, which is extraordinarily satisfying when it comes to patient care, because I think it's very easy to just, especially in first opinion, when you don't get particularly intricate cases a lot of the time, just turn tables in a way. And it really matters to me that the team are starting to evolve their skill set alongside me realizing that we can put so much more effort even into what might potentially be the mundane pancreatitis case, where there's a very set protocol. You know, they're really starting to evolve their nursing skill set. And I think that having learned what I did on the course, I like to think that I'm contributing to that. So the aspect of the course that I found the most challenging is a really easy one for me to answer. I'm sure that most people would say time management. For me, yeah, time management, obviously. But I was diagnosed with ADHD shortly after I began, and I'm a single mother. And for me, it was concentration and having to apply myself. Now, I hadn't been in education for 10 years, so I just loved the support that I got when it came to writing, because academic writing, no practice whatsoever. Gina, who ran the pathway I did, and Purdy as well, were so incredibly supportive when I was struggling. And they really helped point me in the right direction and enabled me to get those things on paper. And ultimately, at the end, it was actually one of the parts that I enjoyed the most. I think I panicked a little bit and obviously didn't really trust my ability, but those two ladies really helped me to believe in myself. My top tip for someone thinking about doing the course is go for it. What's the worst that can happen? You might as well have a go. If you've got a passion which most of us do, let's be honest, or we wouldn't still be here, would we? For patient care, for learning a new skill. And if you want to contribute in a broader sense, then this will set you up, and it will teach you self-worth, self-confidence. I think that's one of the biggest take homes for me, is that I can do it, and that was so valuable. So just do it, go for it. How I plan to use my skills and knowledge in practice, I am very much already putting that into what I do every day. I am contributing much more to the diagnostic process. I'm helping my colleagues, in particular with the microscope. I'm always glued to that thing. I have started to update protocols, and I am so overjoyed that I was able to get a place on the clinical advisory board for medicine. I'm one of the first nurses to ever sit on that board, so that's really exciting, and that's going to help me to contribute to best process and best practice on a much wider scale, so on a national scale. So if I hadn't done this course, I don't think I'd have had the confidence to apply for that. After completing the course, I have gained a lot of insight into how I can contribute in a wider sense. So obviously the medical advisory board that I now advise for, I'm writing clinical guidelines alongside some specialists. I'm really hoping this was just the first step in my further education. I've got my eyes on a postgraduate certificate next, hopefully with the RVC, but we will see. And then who knows, I'm looking towards masters and then hopefully onto the PhD. But that's a way away, so we will see. I would recommend this course because the ladies who run it are incredibly supportive. They've got a wealth of knowledge, Purdy in particular. Obviously her name precedes her a bit. They're all lovely, and I think that as nurses we have to push ourselves a little bit harder. We have to base ourselves in academia in order to be recognised for what we are capable of. So I would recommend this course because it gives you a really good grounding to potentially pursue other interests, potentially academia. And I think that it will inspire more confidence than you realise that you have. I think ability is something that can often remain hidden for a long, long time. It always surprises me how much I enjoy the things I don't think I'm going to enjoy. Maybe that's just me, I don't know. But I think you should do it for you. You might just be surprised what you can achieve.